Hi, good evening, welcome. My name is Robin Foreman and I'm the Provost of Tulane University. And if you're not familiar with the structure of university leadership, that title means that I'm the Chief Academic Officer and I have the honor of overseeing the educational and research mission of this remarkable university. And I am so pleased to be with you tonight to welcome you to the inaugural event for the 50th anniversary of the Tulane MD-MPH program. This is a really special event, and I want to tell you just a little bit about why it seems to me to be so important that we celebrate this moment. Tulane was founded in 1834 as the Medical College of Louisiana to help the region deal with fears of tropical diseases, of cholera and yellow fever and malaria. So the question is, were we founded as a medical school or a school of public health? Right? So this is the subject of some friendly trash talking between the deans of the corresponding schools, but the answer is both, right? Especially when it comes to the study of infectious diseases. The questions about health of the individual and questions about health of the population are inseparable. They're constantly feeding back in on itself. And we were founded precisely to deal with issues of that sort. But now to fast forward a little bit, we created the first school of public health in the country at Tulane in 1912. And over time, the dean of our school was editor-in-chief of the first official publication of the new Public Health Professional Society. And they began defining the boundaries of what is public health and defining its own academic mission and jargon and standards. And over some time, the study of medicine and the study of public health moved away from each other, as all academic disciplines do as they develop their own boundaries. But in 1971, we realized this vision of bringing them back together again so that we could help create these remarkable physician leaders who bring both the expertise in individual healthcare and these remarkable insights at the population level. So we established the program, like I said, in 1971. It was one of the first programs of its kind, and it's been a top producer nationwide of physicians with public health degrees. We started with a very tiny class of students in 1971. We've grown to about 40 students per class, and we have graduated almost 1,200 people over the 50 years of the existence of this program. This is truly just a remarkable success, a crown jewel of the university, and it represents what Tulane is at its best. It's a commitment to interdisciplinary education and scholarship on a subject where interdisciplinarity is absolutely crucial. And it represents the very best of the shared values of the co-sponsoring schools, the School of Medicine and the School of Public Health and Tropical Medicine. It really is a national model, something that we all take great pride in. And not only because of the quality of the program, but also, of course, the quality of the alums. The folks who are leaving this program and going around the country and around the world and establishing themselves as absolute leaders in personal and global healthcare. So anyway, thank you for allowing me to be part of this special evening. And now I want to turn the floor over to someone who is a close colleague of mine and someone who inspires me every day, but is a real leader of this particular program, and that's Dr. Tonette Krousel-Wood. Tonette is a professor of medicine in the Tulane School of Medicine, professor of epidemiology in the Tulane School of Public Health and Tropical Medicine, and serves in several leadership roles. I will tell you personally, too many leadership roles across the university. So she's associate provost for the health sciences, which means she works closely with me in that regard. She's also senior associate dean of faculty and associate dean for Public Health and Medical Education at Tulane University. And that title means Associate Dean for Public Health and Medical Education means she oversees this joint degree program. She herself has dual degrees in medicine and public health and is an absolutely world-renowned scholar. She works on constant NIH funding and such topics as adherence to prescribed protocols and therapies, management of hypertension, health services and outcomes in patients with chronic cardiometabolic diseases. She's published her results in the top journals in the country, over 140 publications, and she's been PI on some grants that go well beyond herself, that take her work through the educational mission at Tulane and out into the community. I'm just going to mention three so you get a sense of the breadth of her impact. She was principal investigator and research director of the NIH K-12 Building Interdisciplinary Research Careers in Women's Health, what's colloquially called BIRCH, BIRCH Faculty Development Award. She's principal investigator for the Tulane Stimulating Access to Research and Residency STAR Award in R38. And most recently, she was one of the PIs of the Louisiana Community Engagement Alliance, the SEAL grant, C-E-A-L, in which she's working with residents, community leaders, federally qualified health centers, faith-based organizations, community pharmacies, and the Louisiana Department of Health to raise awareness about COVID-19, fight misperceptions within vulnerable communities hardest hit by the pandemic in Orleans, Jefferson, East Baton Rouge, and rural parishes, making sure that everybody has access to the latest, most accurate information, and that they can make important decisions about their own health and the health of their community with the best available insights. And then finally, I'll say it won't surprise you, based on all of her accomplishments, that she's an absolute star and a national leader among her colleagues. And let me just tell you some of the national leadership positions she's held. She's chair of the National Institutes of Health Studies section in Health Services Organization Delivery, president of the Southern Society for Clinical Investigation, president of Delta Omega National Public Health Honorary Society, president-elect of the Board of Regents for the American College of Preventive Medicine, and chair and president of the American Board of Preventive Medicine, and a member of the National Institutes of Health Center for Scientific Review Advisory Council. She's also a fellow of the American College of Preventive Medicine and a fellow of the American Heart Association. I really can't think of very few people who can even compete with Tonette for playing more of a role in building the university of today, in which we all take so much pride. Her efforts underpin so much of what we find so exciting about Tulane, but nothing more so than this MD-MPH program, which she is absolutely passionate about. And I would tell you, I can't imagine anyone who's more of a cheerleader for the program, bringing her excitement about the program to all kinds of conversations and efforts around the campus, making sure folks are aware of what a remarkable resource we have. She's the perfect person to kind of host today's event. So with that, I want to turn the floor over to Tonette Krousel-Wood. Tonette, take it away.
Thank you so much, Dr. Foreman. I really appreciate your kind words and this wonderful opportunity to just initiate the celebration of the 50th anniversary for the MDMPH program. This isn't just an opportunity for us to give you updates on the program, but it's more importantly to be able to share the accomplishments and the contributions of our students and our alumni who are learning and practicing at the intersection between medicine and public health, and that they are leading advances in their communities to improve wellness and build health resilience. So I'm so looking forward to this event and sharing with you all these advances. I would like to introduce, just one second, here we go. I would like to introduce two of my wonderful colleagues who will be presenting with me today and providing updates on the program infrastructure. Dr. Mark Dal Corso, who is a clinical associate professor in the School of Public Health and Tropical Medicine, but he has a critical and important role as the MPH Rotation faculty director. And you'll be hearing from him a little bit later. Also, Adam Mace, who serves as the director of the MDMPH program, who does a phenomenal job in coordinating all of the activities with the program and making sure that our students stay connected and on track. And of course, there's a very special thanks to our senior program coordinator, Rachel Rose-Courier, who without her efforts and support today, this presentation wouldn't be possible in preparing all the updates for you. So I want to begin by talking just briefly about the 50 years of medical advances and breakthroughs, as well as the public health challenges, the clinical and public health challenges that we have had. As we know, over the last 50 years, numerous things have occurred. When we look at what has happened with vaccines, we used to boast of the HPV vaccine, but now with the alignment of the scientific breakthroughs we have with COVID-19 vaccines, as well as the resources that were put towards it, it was a record turnaround in developing a safe and effective vaccine to help us put a lid on COVID-19. But also the advances in pharmaceuticals, including the antivirals, chemotherapeutic advances, as well as what's happening for the treatment of autoimmune diseases. Surgical improvements, including organ transplants, have emerged in the last 50 years. Medical imaging has allowed us to see things we could never see before, diagnose early in diseases, and be able to implement treatments that can save lives and reduce morbidity. Interventional cardiology turned around what we were facing with high mortality rates with cardiovascular disease. The anti-smoking laws also addressed critical prevention activities that actually reduced many of the complications that we were having with chronic diseases and cancer. And of course, even in the scientific area, with the Belmont Report and the emergence of evidence-based medicine, it has been, a banner 50 years in medicine and in public health. But despite all of these advances, we have certainly continued to have challenges, and new things have emerged. When we look at what's happening in chronic diseases, as people are living longer, we're faced with more challenges with uncontrolled hypertension and diabetes. The epidemic of obesity in this country that's going global is also of concern. We've been faced with HIV and the AIDS pandemic, other infectious diseases like Ebola and Zika, and of course, what we're dealing with now with COVID-19. The clarity around health disparities and the health inequities that plague our communities has also emerged. The opioid crisis that we were battling heavily before the emergence of COVID-19, and of course our ongoing concern and challenge around healthcare access and inequity. The aging population is been an emerging challenge and will continue to be one, especially as we're seeing continued complications around dementia and other age-related disorders. And of course, all of these things negatively impact patient outcomes and quality of life. Of course, as though our playing card was not full enough with challenges, we got hit with COVID-19 in 2019. And this pandemic shed a new but a very intensely bright light on the challenges that we face as a community and the vulnerability that we have as humans. And certainly it signaled the opportunity for individuals, communities, and the nation to prioritize health and health equity, to be better prepared for health crises of all types, whether it be pandemics of infectious diseases, whether it be epidemics of chronic diseases, hurricanes, fires. We need to certainly be prepared. So we look then at health, resilience, and vulnerability, and how these intersect at this very crucial time. Those of us who are here tonight, many are physicians and MDMPH trained individuals, know that health is much more than the clinical diagnosis on a form. It encompasses the physical, behavioral, social, and environmental health and well-being that encompasses everything about an individual and the communities in which they live. Resilience has been defined as the capacity to recover quickly from difficulties. And we'll talk a little bit more about that in a minute. But human vulnerability is a concept that is very important in any disaster, and it's a very complex phenomenon. It engages and involves social, economic, health, and cultural dimensions, and there are two sides to it. It includes the susceptibility, which is the degree of exposure to dangerous hazards, and resilience, which is the capacity to cope or to recover. Resilience comes in two flavors, if you will, our two main themes, and that be individual resilience as well as the community resilience. And you can see for individuals, this is the ability of adapting well in the face of adversity. It can be learned, but it does take time and it must be intentional. On the community side, this involves strengthening health systems, meeting the needs of vulnerable groups, promoting organizational competence, social connectedness, psychological health, and encourages actions that build preparedness, promote strong day-to-day systems, and address the underlying social determinants of health, which we have all come to realize the importance that these play in light of the current pandemic and beyond. What you really see here is we're faced with crises and engaging with resilience, is that these things happen at the intersection of medicine and public health. And so here we are with the relevance to the MDMPH program, because MDMPH training occurs at the interface and the intersection between medicine and public health. Not only is it growing and gaining and increasing an effective and well-trained clinical and public health workforce, but it's providing the individuals who receive the training the skills to actually address clinical and public health challenges, engage in science and research to help generate new knowledge that can lead to discovery, as well as new methods and approaches to improving health. And this is where the MDMPH program training lies, in preparing the next generation of medical leaders to effectively address the medical and the public health challenges of the 21st century and beyond. Now, no presentation about the MDMPH program can actually be given without giving due credit to Dr. John Walsh. Although the School of Medicine and the School of Public Health, under his leadership as former Vice Chancellor of Tulane University, had ongoing interactions and were doing a type of training of individuals. It was not until 1971, with his vision, that the MDMPH program was officially established as a combined program that could serve and leverage the benefits and the resources of both schools. He was an exceptional physician, an outstanding leader, and wholeheartedly committed to the MDMPH program and to the formal training of physicians in public health. He worked tirelessly to raise money for the MDMPH program. As a matter of fact, up until the day he died, he was raising money for this program to provide scholarships for medical students seeking to get a public health degree. Where a huge debt of gratitude to Dr. John Walsh, and remember him fondly, and his commitment to Tulane, to his community, and to the training the next generation of leaders. He would be very proud to know, as Dr. Foreman already mentioned, that we have nearly 1,200 graduates from the Tulane MDMPH program, that being one of the first programs in the country and one of the most successful, we are considered nationally as a top producer of dual degree MDMPH students. And our graduates are fighting the fight on the national and the global landscape to help improve health for the communities and create a better world for all of us. Some program highlights of our MDMPH alumni include the ones that are listed here. You can see that we have named leaders in government, in industry, in clinical medicine, in academics, in research. We have directors at the Centers for Disease Control. We have leaders of the Bogalusa Heart Study here in New Orleans. We have CEOs at top-tier institutions. We have individuals who are serving as state health officers right here in Louisiana that are on the front lines of COVID-19. We have top plastic surgeons named for Middle America. And we have a chief health officer, the inaugural chief health officer for Google. And of course, listed last, but certainly not the least, is our most recent contribution, which are the numerous alumni that are working, and our students that are working on the front lines to combat COVID-19 in our community. Because of our tremendous interest in understanding what the impact of formal public health education has on the career outcomes of medical school graduates, and because Tulane, being one of the earliest programs and the largest program nationally, we were actually able to conduct a retrospective cohort study comparing the professional outcomes of those physicians at Tulane who had a combined MD-MPH training and comparing to those who did not get MD-MPH training. We were able to capture the graduates from 1985 to 1997 and followed them for an average of 16 years to see what happened to them and what they reported with respect to their professional engagement and accomplishments. What we found is in training, although we have a broad spectrum of training, our MD-MPH graduates were 1.7 times more likely to complete generalist primary care training. For practice, they were more likely to engage in academic institutions, government agencies, and to practice primary care. An unexpected, but not really a surprising finding is what we saw on the research side. Although the MD-MPH was not designed to be a research degree, it does provide the foundational knowledge and skills to allow our students and our graduates to engage in the scientific enterprise. And what you can see here, they were 2 times more likely to engage in research, almost 9 times more likely to engage in research in public health field, 3 times more likely to get federal funding, two times more likely to get more than 4 peer-reviewed publications, and over 2 times more likely to have more than 5 scientific presentations. And although the metrics are great and interesting, and they're wonderful accomplishments of our graduates, what's really important is what this translates into. And what this translates into are advances in the field of medicine that can be used to improve health in individuals and in the communities in which they live and learn. So that overall, we have a better community, we have a better nation, we have a better world. When we look at our MD-MPH versus MD-only graduates from this same time period, although we see many of our graduates, whether they have the MPH degree or not, are involved in the care of the underserved. They're also in administrative roles, making policy decisions, and also were involved in teaching. What you can see is that we have a higher proportion of those completing the MPH degree that are engaged in these activities compared to those without. So if we go a little more currently, and we're looking at 3 cohorts from 2005 to 2019, what you can see represented in the green bar is the 2005 to 2009, then the ivory bar 2010 to 2014, and the blue bar from 2015 to 2019. And what you'll see overall is that our graduates are across the spectrum with the types of specialties they go into. You can see that there's still a high preference for generalist primary care, and you can see that there are increases that are emerging in medicine, neurology, orthopedics, and psychiatry. So one of our pillars of leaders is to build clinical leaders. And our students tell us that this program is providing them that opportunity.
I find that the public health training does help in my medical school training, and that the things that I learn in medicine, I can ground into a real world context and get to understand patients for the actual realities that they face, as opposed to just their symptoms. I know that the majority of someone's health outcomes are not determined by the 15 minutes that you spend in the exam room with a doctor, but really come from the resources that you have available to you in your community.
I chose Tulane's MDMPH program for a very specific reason, and that's because I plan to pursue a career in infectious disease. I have an extremely long-standing interest in ID, and that was the driving force behind my decision to come to Tulane and to particularly apply to their MDMPH program.
So when we look at even our 2020 graduates, what you can see is that they are matching in a spectrum of residencies across the US. They're in over half of the states in the United States, and you can see it includes primary care all the way to multiple specialties and subspecialties. What we also see is that our graduates are matching in outstanding institutions, including several of the AAU, the American Association of Universities, which are top tier academic and research institutions represented in the red font on this screen. Our students are making headway and making headlines in what they're doing. So now I'd like to turn this portion of the presentation over to Dr. Dal Corso and Adam Mays for the MDMPH program structure. Adam?
Thank you for the introduction, Dr. Krousel-Wood. I'll provide a brief overview of our current MDMPH program options, timeline, and student body. We offer two different options for our Tulane School of Medicine students to participate in the MDMPH program. The first and most popular is the 4-year MDMPH program, which allows our students to integrate their public health studies with their clinical studies in the same 4 years. Tulane was one of the first schools to offer this format, and although other schools of medicine have recently adopted this model, it remains relatively rare. The 4-year program allows our students to stay with their entering medical school class and complete the degree requirements without taking extra time or delaying their residency program. We also have a 5-year MDMPH program option, where our students are able to take a year off from their medical school studies to focus on their public health coursework, primarily after their 2nd or 3rd year of medical school. While some students apply for the 5-year program, the majority will start off in the 4-year program and transfer to the 5-year program to devote more attention to their public health studies, or potentially to engage in additional research or fellowship opportunities in that year off that wouldn't be possible if they were in medical school. Tulane also introduced an MD-PhD in public health program in the last decade. It allows our students to complete that PhD in public health in one of our 6 School of Public Health and Tropical Medicine departments. Many MD-PhD students will start out in the MDMPH program, find that they're very interested in it, and continue on with PhD studies. Alternatively, some of our students will come in with MPH degrees prior to matriculation to medical school and decide to pursue the PhD. Generally requires several years off from the School of Medicine to allow students to take coursework, perform research, go through their comprehensive examinations and the dissertation, usually for a total of 6 to 7 years. Tulane's MDMPH program remains unique for providing our students with the option to choose from 6 different public health concentrations in which to specialize their MPH degrees, located within the 6 School of Public Health and Tropical Medicine departments. It allows our students to complete more advanced and specialized coursework for programmatic and elective credits that aligns with the student's interests in clinical residency specialties. Each one of these respective MPH degree tracks is within a respective School of Public Health and Tropical Medicine department, which should be obvious from their titles, with the exception of disaster management, which is located in the Environmental Health Sciences department. This thermometer shows the general progression of our 4-year MDMPH program students through their public health requirements from T1 through T4 year. Starting from the base of the thermometer, our students begin with their foundational core coursework in the summer before their T1 semester at the School of Medicine, or the summer between their T1 and T2 year, where there is no medical school coursework. All of our students, regardless of their MPH concentration, complete the same foundational core coursework, which helps to give them a grounding in public health and includes courses in epidemiology, biostatistics, health systems management, and design strategies and public health programs. From their T1 spring semester through their T2 spring semester, students focus on specific programmatic and elective coursework unique to their specific MPH degree concentrations. Programmatic coursework can include courses like epidemiological methods and computer packages for our students in epidemiology, monitoring and evaluation of global health programs for our students in community health sciences, medical helminthology and medical protozoology for our students in tropical medicine, and quality management and healthcare for our students in health systems management. Similarly, their elective coursework varies by their respective degree concentration and can include courses like design and conduct of clinical trials for our students in epidemiology, social innovation in the public health profession and public health policy for our students in community health sciences, and disaster and emergency communication for our students in the disaster management program. With the exception of tropical medicine, most of our students will complete their public health coursework by the end of their T2 year. Our tropical medicine students will complete several clinical tropical medicine courses in their T4 fall semester. In their T3 year, our students will go to the SOM to complete their clinical rotations and are really not completing any public health requirements at that time. In T4 year, while completing their elective rotations at the School of Medicine, our students will complete their integrated learning experience public health analysis, in which they'll work with their faculty advisor to perform an analysis on a specific topic of public health while integrating their content from their coursework and their degree program competencies, oftentimes choosing a topic that connects to their residency specialty of choice. Although it's not required, we have had several students decide to publish these papers in journals after the program. Finally, our students will complete their MDMPH rotation as an elective rotation in their T4 year. The MDMPH rotation fulfills the MPH degree requirement for a practicum or applied practice experience and allows our students to do a public health rotation at a local, national, or international site that helps to apply their public health studies in a real-world setting and to benefit their host organizations. You'll hear more about that and how our students engage with their communities with Dr. Dal Corso. Upon completing these graduations, with these requirements by the T4 spring semester, the students will be certified for graduation. This graph shows the total number of our current MD/MPH students in our 3 most recent classes in their respective degree concentrations. There's been an overall upward trend in both student applications and matriculation in the last 3 cycles, with class numbers now generally in 30 to 40 student range each year. Trends in specific degree program tracks generally vary by class year, and the 4 most subscribed in the last 3 years include the Community Health Sciences track, Tropical Medicine, our Health Systems Management track, and the Epidemiology track. Our program also recruits a demographically diverse student body, of which we're very proud. We're excited about increasing student participation in the program and plan to continue that momentum into the future.
So thank you so much, Adam. And for the next section, I wanted to share that, you know, our second pillar of creating this next generation of leaders is in the community and our community leaders, and the role that the MD/MPH practicum experience will play in helping prepare our students for careers that can include community engagement and community advocacy.
So should I start here? Are you going to show the students?
There we go.
Part of what I learned from my MPH training is not just about the inequities that certain communities face and how they face them, but also how to collaborate with those communities and how to build trust and how to have humility and the importance of recognizing learning from people who are affected. And I can bring that into a clinical context. Those are skills that would be essential to building a doctor-patient relationship, which is shown again and again to lead to better patient outcomes, better patient adherence, less physician burnout, more effective diagnoses, and all in all, just makes you a more effective doctor.
Clinical trial design is something that I'm very interested in, and more specifically when it comes to minorities, there's been a severe lack of minority representation in clinical trials. And so one of my goals is to bridge the gap between the community and the research side.
Part of what I learned from...
So I'm going to discuss here briefly the MD/MPH Practicum Rotation, and I think these 2 students, Lauren and Marcus, give a good example. They come from different departments. They have different interests as far as their public health degree, different competencies which they are trying to fulfill in their practicum experience. And they probably also have different plans as far as what their clinical practice will be, what kind of residency that they will match into. And so the practicum rotation is it is set up individually for each person that goes through it. It's about 40 students a year, as Adam mentioned. And Rachel Ruiz-Courier is the coordinator of that program. And together we work to place students in a project which will fit not only with their public health competencies, which they need to fulfill to get their public health degree, but we also try to match it into something which will build into and help them to see the intersection between their clinical work and their public health degree, so that they can continue to use their public health skills in their clinical work as they go through residency and then into practice. And over the years, both Adam and Rachel have done a really good job in meeting with students early in their career, early in medical school. So a lot of those students are able to plan ahead of time and find projects on their own, which match the type of residency they want to go into and also matches their interests in public health. So you may have a community health student who's really interested in health education, and we will usually be able to place them into a practicum experience where, for example, they may be helping to educate patients how to better care for themselves in the area of hypertension, diabetes, those kind of things. And so it creates a great combination between their public health skills and their clinical skills. And this can be done, of course, locally, domestically, internationally. If you want, you can go to the next slide. And, you know, we place them in a lot of different sites mostly within New Orleans. So we work a lot with the Office of Public Health, where I worked previously, the Louisiana Public Health Institute in different clinical settings, the DePaul Community Health Centers, the VA, and other settings within Louisiana. And many students are able to find projects around the country and even in different areas of the world. If you want, you can go to the next slide, Tonette. And they're able to find a number of different projects that they can do linked with either universities or governmental agencies or WHO in different areas of the world. And so to close this part out, I would like to ask each of you listening, if you are out in practice and you have ideas of ways that perhaps an MDMPH student could learn in your setting how to kind of combine their public health and clinical skills. We're always looking for new sites. Here's a list of a wide range of different projects that students have done just in this last year, many of them responding to the COVID pandemic in New Orleans. And of course, many of them can work virtually also. So if you're in another state, we would love to hear from you and see ways that we could place a student with you in order to get this practicum experience in a clinical setting or in a public health setting. So you can move to the next slide, and I'm finished with my section, Tonette.
Thank you. Thank you so much. And so the third pillar of our commitment and our vision for building the next generation of leaders in medicine and public health is our focus on building scientific leaders. And by providing opportunities within the program, our students are able to learn the skills, understand the methods, collect data, conduct analysis, and generate abstracts, presentations, as well as publications that can work to advance the field in which they are most interested in, in which they are working. So when we hear from our students, they tell us why they think this is important.
I know more immediately in my future when it comes to residency, fellowship, and thereafter I plan to continue to do research. And so continue to use the skill set and the knowledge base that I'm developing when it comes to research study design and statistical analyses, the computer packages.
And it's great to hear Marcus talk about his experiences. Alex is one of our MDMPH students that transitioned from the MDMPH, completed his MPH, but transitioned to the MD-PhD because of his interest in research.
Research at Tulane has really opened up several doors for me and also given me an opportunity to meet people that I would have never met.
So many of the opportunities that our students have are made possible by endowed scholarships. We have several that are listed here from the Morgadanis, the Lively, and the Hayward Foundations and families that are supporting research in atherosclerosis, in arthritis and rheumatism, as well as in medical genetics. You see the students that are the current awardees listed here, and these scholarships are making a huge difference in their ability to navigate both degrees and complete important work while they're learning key skills in their quest to be scientific leaders. Another program that we've added, and we're always looking to expand the program and offer new opportunities, is our collaboration with the UAB CTSA program. It's called the TL1 or the CCTS TL1 program. This is a year-out, year-long mentored research training program that's offered to our pre-doctoral medical students. They focus on health disparities as well as diseases and disorders that are disproportionately represented in the Deep South. The NIH provides funding for each of these students up to $45,000 a year that covers not only a stipend, but also tuition and travel and training related experiences. And you can see we've had a large number of our students in the last 5 years enroll in the program, 17, with 11 having completed the program since inception. When we look at the scholarship funds just over the last 2 years, you can see that the Morgadanis Fund has supported students, 6 students, providing $90,000, Lively supporting 3 students, providing $45,000, Horner supporting 1 student for $15,000, and the Hayward Foundation providing $45,000 to support 1 student in that year-out program focused on genetics. There's nearly $500,000 that's been distributed from the NIH-funded TL1 program as well. So these make important differences in student lives and in their training. And of course, we can see from our alumni survey and our study that it's making a difference in what they do when they graduate. So the MDMPH program is supporting 50 years of excellence to support health resilience in our communities and beyond. This training prepares tomorrow's physician, clinical, community, and scientific leaders to see health through a broader lens, one that includes public health and population-based assessment. And when we look at our students, it says, John Quincy Adams said, their actions inspire others to dream more, learn more, do more, and become more. They are truly leaders at this stage, even at this early stage of their career. And for our alumni, John Maxwell noted that leaders are those who know the way, go the way, and show the way. Tulane MDMPH alumni are doing just that. We've shared some of the highlights with you today, but this is just a critical accomplishment of all, and we're incredibly proud of all that they are doing and will do. So we'd like to thank you for being here today in celebration of the 50th anniversary of the MDMPH program. We look forward to hearing from you. If you've got questions, you can email me or actually any one of our members of our program staff and administration. And of course, we do have a website that has a lot of information that's readily available to you and to anyone you may want to share it with to learn more about the Tulane MDMPH program. So we can now open it up for questions from the audience. We've got a few. We've got one in the chat box already. Where do you see the Tulane MDMPH program in 5 or 10 years? How would you like to grow the program, whether in size, scope, or other benchmark? Well, based on the trajectory that we've had to date, I'll take a first stab at it and I'll open it up to my co-presenters as well. I anticipate a continued growth in the program. What's happening in medicine and public health, some call it the Fauci effect as well with COVID-19, I think will further support the engagement in this program as many people are seeing this intersection of medicine and public health and how critical it is to addressing this crisis as well as any others. So we anticipate continued growth and interest in the program over time. And we hope that we continue to see engagement and growth with respect to our community engagement, as well as what we're seeing in the research enterprise by securing additional grants to support students in providing advances in the field. Dr. Dal Corso, Adam Mace, other comments or questions about how you see it?
I'll just make one quick comment, and that is, I think, in the past, maybe people saw their clinical work as one area of their life and public health is another, but I think the integration of those to where you're actually seeing your patients as a population and just having an electronic medical record allows us to do that, to see our patients as a population and really use our public health skills on our population of patients in order to improve their health outcomes and, of course, do more prevention instead of just treatment. And so I think that that's kind of the direction that I'd like to see our students go in, where it's all mixed together in their careers at one time.
Okay, thank you.
I would echo both Dr. Krousel-Wood and Dr. Dal Corso's comments. I do see that program continue to increase the number of students and the amount of participation that we have from both students in both schools. And I'd like to also see the growth in scholarship contributions as well. That's so important for our students. And I know our alumni have already done a great job with that. And I know that the students really, really value it. So I'm hoping to see that also on the upward trend.
Excellent points. Thank you. I see another question in the chat. It says, how does Tulane's joint degree program compare with our peer institutions? I provided a little bit of insight about that. With being one of the first programs that was established, we have the largest number of graduates. It's not just the timing that we started, but it's also our ability to collaborate across schools, very effective with tremendous support from our deans of medicine and public health that make this all possible. That we have a large number of students enrolled in each class. So compared to our peer institutions, we have a very large program, highly successful with high graduation rates. We're over 98% in completion at 4 to 6 years once starting the program, which is a quite incredible metric and landmark. So I would say that nationally we are recognized as one of the top programs, if not the top program, with regards to our ability to deliver the program and secure the graduation of our students. Let's see, I've been looking for another. I've got, do you think the COVID-19 pandemic will change the career path of MD/MPH students and other MD students via the Fauci effect that you mentioned? The pandemic seems to have shown the need for doctors to possess the foundations of joint education. Of course, another excellent question. You know, our attendees always come up with the best questions. I do believe that the COVID-19 is shaping the future of what our program will do and the students that it will attract. Many are coming to realize that it's not just the virus itself, it's in the community that it happens, and the social determinants of health are key contributors to the health disparities and the health equity issues that we're seeing. So it's critical that we are providing this opportunity. I think some will seek this clinical opportunity to look at to work on the front lines of pandemics, and others will use this as an opportunity to look at go further upstream, if you will, and look at some of the prevention measures and what we can do in our community to build a better health and have greater health resilience. Other comments from our panelists?
I would just comment, you know, when these things happen, you know, certainly the AIDS epidemic and Katrina also have an effect not only on the country, but on the school and the students that we have here. And I believe that the Katrina effect of people wanting to come to New Orleans and learn how to really reach out to community, to address inequities, just to reach out to the underserved, has really had an impact on our student body and the types of things that we can do in the New Orleans area. And even though, of course, you don't like to see disasters that happen like Katrina and the COVID pandemic, they do have an influence on the people that decide to make that their career of working in public health and medicine. So I think that it's important to recognize those things.
I don't have too much to add, but I would just say that I've noticed a trend in our recent applicants who have been asking about COVID-19 pandemic and really showing, you know, the relevance of that for the MD/MPH program. So I think it's something that we are already seeing in the students applying for our program now.
Great. So we have another question. An attendee has asked that they assume that there would be a larger portion of the cohorts to study tropical medicine. Why the lower number in concentration? I can open it up to the panelists, and then I can also answer the question as well.
Since I'm not in Trop Med, I don't know if I should take a stab at it, but a lot of what you would learn in Trop Med, I think, is clinical, and it could be that some students just they want to supplement what they're getting in their clinical training in the School of Medicine and look to some of the more social behavioral type topics in epidemiology that you might get in some of the other departments. But certainly each department attracts a unique group of people that have a high level of interest in that area. And some years TropMed is very high, because sometimes they're difficult to find practicums for them, especially if they're in the US. But in general, I think that there's a clinical emphasis there, which part of that they may get in the School of Medicine, but there may be other comments.
My experience is that it really just depends on the individual cohort in terms of the areas that students have an interest in. And that depends on an individual School of Medicine class. And in some years, as Dr. Dal Corso mentioned, we have a high number of tropical medicine students. So I think it's really kind of hard to judge or to think that there's a lack of interest in it per se. I think it really goes by individual class year.
And I will concur. I do anticipate, just given so much focus recently on the emerging and the growing infectious diseases that have tropical underpinnings, that we will see probably an uptick in individuals selecting that as a career option and a training option for the MDMPH program. Let's see. The next question. With the current pandemic and likely the future of pandemics, we will see a focus on physicians looking for public health training in a post-medical school setting. I'm glad that someone asked that question as well. It's a very good one. I do think that we will have more physicians looking to engage in programs. Tulane and other similar schools of public health are offering online programs, and the School of Public Health has got an excellent online program that would make it feasible for practicing physicians to engage in formal public health training. We definitely know that this is important. I would also like to note that there is a residency training called Preventive Medicine, General Preventive Medicine and Public Health. It's an ACGME accredited program. I'm board certified in preventive medicine that actually provides a pathway for those after they finish medical school to focus their training in medicine and public health and to receive certification in this as well. So we have pre and post opportunities, both with residency training as well as achieving a second degree or even a certificate program in public health for those physicians who are interested in gaining additional skills and a knowledge base about that. I see Dr. Rajan, who is one of our wonderful advisors for the MDMPH program in tropical medicine, provided a response to everyone that we have. Sometimes we have huge numbers in tropical medicine, which we already shared. 16 just 2 years ago. They do coursework in the 4th year, and sometimes that causes some challenges for students because they are interested in their interviews as well as some of their clinical rotations. But there's some wonderful opportunities with the restructuring of the tropical medicine program, making it more feasible and doable for the students. And we had one more question that someone asked about how the MDMPH program, is addressing issues around racial inequities. And we continue to remain highly committed, not only as a program, but also as a university, to diversity, not only of our students, our staff, our faculty, but also attention to all of these issues in our community. The MDMPH program training really provides an infrastructure and a foundational knowledge and skills on how to address some of these issues that were certainly brought to light in COVID-19 with disparities with respect to the way of morbidity and mortality were impacted for COVID-19, especially in our vulnerable groups. So please know we remain highly committed to that as a program, as a school, and as a university to our communities and to equity and inclusion. And I believe that is all of our questions for this evening. I can't thank you all enough for taking time out of your evening to be with us, to hear these highlights. We know that several of our alumni have attended today. We hope that you've enjoyed the update. Many of you may have participated in the survey that we did and the study that we published several years ago, looking at the long-term professional outcomes of our graduates. We thank you for being part of the solution for our communities, helping us build resilience for better health for all. Thank you and have a wonderful evening.